we shouldn't fear the acute stress because it in itself isn't the problem. If the stress is a trauma, then we're into a whole different conversation altogether. But if I have a really shocking day, that doesn't move my dial on my health much or the other. But if I have 35 shocking days in a row, then I can start to expect a problem. The challenge on acute versus chronic stress, so chronic stress, and it's hard to define. Some might say chronic is a month, some might say it's 6 months. So different professions will have different definitions. But if I have an acute stress, my plane's a good and a bad example because it's happening in that one moment. And I only had those problems because my flying frequency was so often that it was starting to move towards what might be a chronic stress. I think the key to remember is the body is designed to deal with stress. It's designed to deal with acute. We've got a nervous system that activates to get me out of trouble. And then when I'm out of trouble, it should bring itself back to a position of baseline or calm. But equally, I'm designed for war, I'm designed for famine, I'm designed for childbirth. And when I say I'm designed to support my wife going through childbirth and going through, the juvenile years of children where you can't sleep in the same way. We're not so fragile that we break on the first stress test. So the case in question is not, oh no, again, there's stress. It's a case of, is this stress so often and frequently affecting me that I'm starting to see a diminishment of my core physiology? To really change my physiology, it's got to be a consistent message for 6 weeks. Same if I want to improve my physiology, but also if I want to create a sort of negative cascade. So we shouldn't fear the acute stress because it in itself isn't the problem. If the stress is a trauma, then we're into a whole different conversation altogether. But if I have a really shocking day, that doesn't move my dial on my health much or the other. But if I have 35 shocking days in a row, then I can start to expect a problem. With acute stress, to not give a completely vague answer, on that day, I would want to absolutely restrict alcohol intake because that day I would have been in a state of what we call heightened sympathetic nervous activation. And if I want to turn my body's recovery biology on, called parasympathetic, alcohol suppresses that. So we're told alcohol is a solution to stress, but it's actually an accelerant of stress. Caffeine, an accelerant of stress. Refined carbohydrate foods, an accelerant of stress. So what I've got to make sure is on days when I'm under an acute stress, let's say it's a big board meeting or I'm under extreme pressure at work, those are the days I need less caffeine, less booze, more low intensity exercise versus high intensity exercise. And I need to preserve my physiology as much as possible because there's going to be a large volume of pressures. I just don't want them affecting my body as much.